Module 3, Data Analysis, Communication and Use, part of the Data Support Package to the Leave No One Behind partnership. Welcome back to Module 3 of Development Initiatives, Data Support Package to the Leave No One Behind partnership. Just a reminder that we've put this training package together based on feedback that we had from all the different country coalitions within the Leave No One Behind partnership of what some of the core data-related challenges and dilemmas that you were dealing with that were common across the different coalitions. So we've rolled this package together to address those common issues, and that can then enable peer-to-peer learning, as you'll all be receiving this same content, as well as to facilitate the transfer of data that has been standardized following the same sort of approach and methods onto the tracking progress platform delivered by our partners at IISD. Specifically, the objectives for the whole training package, but also for this module, Module 3, is that you, the course participants from Leave No One Behind country coalitions, gain improved knowledge on data-related issues that you can then apply in your own context to strengthen the quality of community-generated data being collected, managed, and used. And by quality, what do we mean? Well, it's three-pronged. So firstly, it's about respondents' welfare. So that's about empowering and promoting the interests of the people that you're collecting the data from and protecting them from harm throughout the data lifecycle. It's also about robustness. So some of these more technical or scientific standards of data. And finally, it's about impact. So making sure your data is good enough to reach the people that it needs to reach and communicates the messages and the findings that are necessary to achieve the change that you're seeking. So throughout this course, you'll see text highlighted in these different colours, in the red for thinking about the interests of your respondents, the people that you're doing this research for, blue for the technical statistical research and data standards, and green for impact. So keep an eye out for these different colour codings throughout the course to address these different dimensions of quality. This is the data lifecycle, and in Module 1 we talked through preparation and collection of data, so getting that data in the first place. In Module 2, we've been talking about the processing, management and storage of that data. So what we do once we've collected it to make sure that we've got nice, clean, reliable data that's also safe and secure. This module is all about the analysis, communication and use. So building on those really strong foundations of good quality data that's been collected and safely secured, now we're in the position to do something useful with it. So this is the exciting module. We're going to continue with our example that is going to illustrate some of the more theoretical and conceptual ideas and tools we're going to present throughout this module. So we're going to translate that into the context of Deviland. So Deviland is a place where an organisation of persons with learning disabilities has approached us to collect for them some high quality data that is hopefully going to be shared with international funders and the national government to influence funding decisions and mobilise action to address the issues that have been raised by the data collected about the experiences of persons with disability with local healthcare facilities. So we're running this example throughout this module too. A recap on what we covered in Module 1, which was all about data collection. So how did we make sure that we've got really good quality data collected in the first place? Well, firstly, we asked that critical question of whether or not we needed to collect data at all, or whether there was indeed existing data that would suffice. And we decided that yes, indeed, new primary data collection was necessary. We looked at the legal and regulatory context, understood it and adhered to it. We conducted an ethical review, which we then used to identify risks, which were then in turn mitigated throughout the data lifecycle and the research process. Designed a great survey with a questionnaire developed and all the research tools developed that we needed, and a sampling method and sampling frame and sample size were also identified, which we then used to go out into the field and ask our questions and collect the data. That ensured that we have a good foundation, we've identified the research questions, and we've gone out with a great survey tool to collect the data from the people that we want to collect the data from. We then take that data back and start to make sure that it's nice and clean. So get rid of all the errors and inconsistencies that appear in the data set. Nice, clean data set. But then the second most critical question, we had to make sure that individuals couldn't be identified within that data set. So we went about a process of anonymization and pseudonymization. Once we made sure that we then had a fully anonymous data set, we then chose an appropriate storage facility to make sure that it was secure and that only approved and appropriate people can access the data in different capacities. We made sure that we drafted a codebook and metadata that were making it very clear about exactly what kind of data we had, so that that's very transparent for anyone else who's looking at the data to understand what kind of data we're handling and what questions were asked and what answer options were available. And we also have made great efforts to ensure the interoperability of the data with other data systems so that it's easily accessed and transferred and can be triangulated with other existing available data sources. So now we've got this great quality data collected that's nice and clean, safely secured, anonymous, and interoperable with other data systems. What do we do with all that data? We're now talking through analysis, communication, and use. We'll start with talking through some of the more straightforward descriptive statistics. Then we'll go into disaggregation and how to do a disaggregated analysis with your data. We'll talk about correlation and look for patterns in the data. Then we'll go into causation, understanding the drivers, what's behind some of the answers that people are giving. A bit about comparative analysis, and finally, presentation for impact. So we're starting this section by talking about descriptive statistics. These are simple descriptions of what your data tells you. So provide a simple presentation of the answers to each question. This can include frequency tables and charts. So this means that for each question, you provide a table of how many people responded to which particular answers to that question. You can present that as a table or you can present that as a chart. You should also report the average answer for each particular question. Averages in general follow one of three methodologies, either calculated as the mean, so that means adding up all the answers that you've been given for your whole sample and dividing it by the total number of people in your sample to get the average or the mean response to that question. The mode is the most frequent answer category given to that particular question. And the median is if you have data that is quantitative and you can line up from the lowest to the highest value, and you lined up all the responses to that question, what is the number that would fall in the middle? And that's your median. Alongside the frequency tables and the averages, it's also important to have a look at the dispersion of the answers to any given question. So the dispersion is about the range or the spread of answers. The minimum value, the maximum value, and the range in between that minimum and the maximum value tells you about that spread. So how varied are the answers that have been given by your sample to that particular question? The variance and the standard deviation are statistical calculations that tell you about the average distance apart that different answers have been given, or the average distance that any given answer is likely to be from the average or from the mean response to that question. So very high values for variance tell you that there's lots of different answers very spread out for that question. Very low values for variance and standard deviation tells you that answers tend to be very clustered together. So your sample are tending to give very similar answers to that particular question. Here is a frequency chart to the question, how regularly do you access your local primary healthcare facility? Here we can see in our sample of a total of about 271 people, 100 people said they often access their local primary healthcare facility. Fewer people, 75 people, said that was sometimes, and fewer still, around 60 people said they never access their local healthcare facility. It's also important to present the number of people, the number of responses you got that said don't know or that didn't respond to the question at all. That's important for transparency to see, therefore, what you're basing your substantive analysis on is not 100% of your sample. In fact, there are some people that didn't give an answer to that question. So alongside the frequencies, just presenting the number of people that responded to each answer category, we should also be presenting these other descriptive statistics about the average and the dispersion. So here we're taking the answers to the question of the distance or how far away people live from their local primary healthcare facility. The minimum value, so the shortest distance that people lived from their healthcare facility, was 0.1 kilometre, very close, right on top of it. The maximum value is 23 kilometres. They're living very, very far away. The mean, when we added up everyone's answer and divided it by the total sample, was 3 kilometres, so a reasonable distance. And the standard deviation is quite low, it's 1. So that means that most people live around 3, 4, 2 kilometres from their local primary healthcare facility. And that 23, that's somewhat of an outlier. It's quite unusual for someone to live that far away. We can also present qualitative data in a way that is helpful and summarizing. So we don't have the same kind of numbers that allow us to calculate means, for example, but what we can do is code the answers to qualitative questions in a way that gives us a nice summary of what people are saying. So the example we have here is the question which asks people to describe qualitatively what their experience of discrimination in their local healthcare facility was. And we have a range of qualitative answers, everything from rude and abusive staff to having to pay a bribe. These two answers are very different. But we can find within these different answers that have been given some patterns and some similarities. So while one person answers that they experienced rude and abusive staff, that's quite similar to the person who responded that they felt that they were laughed at. We can cluster that together into different kind of answer categories and code them to a particular theme or idea. And this is a sort of thematic analysis of your qualitative data. So rude and abusive staff and being laughed at are all related to the behaviour of healthcare workers. So what we can do is assign the qualitative answers that were given to particular themes, and then we can count up the number of responses we have for those particular themes and present frequency tables like this one here, or charts as I showed in the previous slide. Now, those descriptive statistics are generally presented for the whole of the sample of data that you've collected. But what's really important, particularly for a Leave No One Behind analysis, is to understand how different groups within your sample have been affected differently, and how you might have different kinds of answers and particularly poorer outcomes for one particular group than another. So how are you going to split your sample and analyze your sample and your data differently for these different groups? Well, there are some core variables that you might use to split your sample up and to compare the differences between different groups. These core or standard variables are based on what we know about discrimination and inequalities globally, systematically around the world, that are worth exploring and investigating in any context. These include sex and disaggregating between and comparing between answers that came from males and answers that came from females. It includes age, disability status, ethnicity, and geography. And the geography variable may be urban versus rural, or it may be north versus south, or any particular categorization of the geography that you're working in that is relevant and where there are likely to be inequalities and different experiences. But moreover, for the particular group that you're focused on in your context, there may be another variable that may be more important to disaggregate your data by. So you may be much more interested in employment status and the difference between people that are employed or employed in a certain profession compared to people that are unemployed or employed in a different profession. Religion may be the main distinguishing factor to someone's discrimination. Gender and sexuality, beyond looking at the simple binary of sex, there may be gender and sexuality discrimination issues that are determining people's outcomes. Indigenous populations, migrant status, income levels, lots of different variables that you would be interested in comparing different populations by. Importantly, though, we don't just have one identity. We have intersecting identity. We carry many different identities all at the same time that layer on top of each other or compound to give us a particular outcome or experience. What do I mean by this? Well, all of us have a gender, a particular kind of gender. So whether we're male or female, that may be a way that we want to split the data to compare whether your experience is different because you're a male versus a female. But at the same time, we all have a certain income level. And you may be interested in the differences between people that are on low incomes compared to people that have high incomes. But people on low incomes and high incomes also have a gender. So within the low income group, you want to compare males and females of a low income, and similarly for the high income group. At the same time, we also all have a particular ethnic origin. So now you're splitting the data even further. If your left behind group, if the most marginalized group set of individuals in your sample and in your population is, for example, women that are from an ethnic minority and living in poverty, you need to be able to disaggregate your data by all those three variables, by gender, by income, and by ethnic origin, to identify that particular group of individuals that have all those intersecting identities. Now, the challenge is once you get to that level of detail about an individual, and once you are layering and compounding all those identities, the sample size you're working with in your data gets much smaller. So you have fewer women that are of the particular ethnic minority and living in poverty in your sample than you do of when you're just looking at comparing between men and women, for example. And the smaller your sample gets, the less certainty and the less confidence you have that that sample is representative of all of the population of women of the ethnic minority and living in poverty. So the more intersectional analysis you do, the more of these layers that you apply, the smaller the sample of people that have all those intersecting identities, and therefore the less confidence you have that the results that you're getting in your data and your findings are representative of that particular group with all those layered identities. I'll go through that again in this example. So going back to Deviland, we asked the question of whether or not the treatment people received at their local healthcare facility was good or very good. And of the total sample of everyone we asked, 52% of people said it was good or very good. So about half of the people in our sample said it was good or very good. But we wanted to compare between men and women. And it turns out that more men, 60% of men, said it was good or very good, while 45% of women said it was good or very good. So you're more likely to have a positive experience if you are a man. But let's go a little bit deeper. What kind of men are receiving better treatment than others, and what kind of women are receiving better treatment than others? We then broke the data down by age, looking at men below 40 and above 40. And here we find a huge difference. So men under the age of 40 are much more likely to have a positive experience. 75% of them said it was good or very good, compared to men that are older, that are over 40, where only 35% of people had a positive experience. For women, we see the same pattern. So women under the age of 40 are very likely to receive a good or very good service, 71% of them, whereas older women, 25%, only 25% of people, women had a good or very good service. As you can see from this, a woman under the age of 40 is more likely to have a positive experience of their local healthcare facility than a man on average, and certainly than a man over the age of 40. So whilst, yes, there is indeed a difference between men and women, actually age is an even more important variable here, and it's not all women that are receiving the poor treatment. Going one level further, we then look at, of those older men and of those older women, just looking at the people living in poverty, in extreme poverty, on less than $1 a day, and we see that only 5% of people reported a good or very good experience. So it seems that living in poverty is an even more important factor. 95% of people that were in our survey that live in poverty, men or women, said that they didn't receive a good or very good treatment in their local healthcare facility. Now, going back to my previous slide where I was talking about the challenge of sample sizes, how much confidence do we have in this data and in breaking it down in this number of levels for this level of disaggregation and intersectional analysis? Well, we started off with a sample size here of 271 people. So 271 people said that they answered the question of whether or not they received good or very good treatment at the local healthcare facility. We more or less had an equal number of men and women, so we had 143 men answer the question and 128 women. So I'm fairly confident there that I've got a decent enough sample size that I can say something meaningful about the difference between 143 men saying this and 128 women. As I get to the next level, I had 90 men below the age of 40 and 53 above the age of 40. I had 82 women below the age of 40 and 46 women above the age of 40. These are much smaller, right? So we're already starting to get smaller samples. I'm now comparing the answers of 46 individuals with the answers of 82, 53 and 90. I've got much less confidence that that is therefore representative of that population than I did when I was talking about answers from 271 individuals. When I get down to the statements that I was making about women and men living in poverty, actually I'm basing this answer on the answers of just 3 women who live in extreme poverty that are over the age of 40 and just 7 men who live in extreme poverty over the age of 40. So these are much, much smaller numbers, and I have much less confidence that these are representative of that whole population. It doesn't mean it's not true, it just means the confidence that I have in those answers is much smaller. So in the last slide, we were looking at patterns in the data, where people of one particular identity tended to give answers that were different from people with another identity. Correlation analysis is all about using statistical methods to quantify some of these patterns that we see in the data. We describe correlation as a quantifiable statistical relationship between 2 variables, so that when one variable changes in a particular direction, we see a different variable move at the same time, and we have a value for the strength of that relationship and the degree to which the movement in one variable coincides with a movement in the other variable. The coefficient, the correlation coefficient, is that quantity, is that value that we're assigning to that particular relationship between 2 variables. So a correlation coefficient takes the value of 1 when there is perfect positive correlation. So that means if one variable goes up and increases, another variable at the same time will also increase in proportion with that first variable changing. A correlation coefficient of 0 means that there is no relationship whatsoever between these 2 variables. So when the first variable goes up, the second variable could go up, could go down, could stay the same. It's completely unrelated. There is no pattern between how somebody answers the first question to how somebody answers the second question. A correlation coefficient of -1 represents perfect negative correlation. So what that means is when the first variable goes up, the second variable goes down. So there is a perfect relationship between these 2 questions, but they work in reverse. So as one value goes up, the other value goes down. So let's look at some of this on a chart, what that might look like in your data. So here we're comparing the answers to the questions of the distance someone lives from the local healthcare facility to the cost of accessing that local healthcare facility. Positive correlation, perfect positive correlation, looks like a straight line going up as you see in this chart. So where people live a short distance to the local healthcare facility, they also have a very low cost of accessing that local healthcare facility. So this is a presentation of what that would look like if you had perfect positive correlation between these 2 answers. If you had no correlation between these two answers, it would be comparing the cost of accessing a local healthcare facility with age. Here we can see as the cost of accessing the local healthcare facility goes up, the age darts all over the place. There's no clear relationship. There's no pattern here. The age and the cost of accessing the local healthcare facility do not seem to be related at all. We have no correlation. Perfect negative correlation is a line sloping downwards, as you can see here. And this is looking at the cost of accessing the local healthcare facility with income. This is an interesting one. So as somebody's income is increasing, as you're moving up the y-axis here, the cost of accessing the local healthcare facility declines. In other words, the more money you have, in fact, the less it costs you to access your local healthcare facility. People on the very lowest incomes, lowest numbers, pay the most to access their local healthcare facility. So this is an example of a negative correlation. The correlation coefficient, so the value, the statistical value that we're assigning to this relationship, to the relationship we've just seen on those charts in the previous slides, can be calculated using a variety of different methods. And the method you use in the correlation coefficient calculation depends on the distribution of your data and the kind of relationship that you think is likely between your variables. Now I'm going to describe what is probably the most straightforward correlation coefficient calculation, which is called Pearson's R. So this, if you like, is your entry-level correlation coefficient, usually used when you're expecting to see a straight line relationship, as I showed in those previous charts, a proportional relationship as one value goes up, the other goes up or down in proportion in a straight line with that first variable. So R is the correlation coefficient. R is the correlation coefficient between variable X and variable Y. So Rxy is just the name, if you like, of the correlation coefficient that looks at the relationship between variable X and variable Y. In our example, variable X was the income, somebody's income, and variable Y was the cost of accessing the local healthcare facility. This is the formula. So in the formula, we have here cov xy, which is the covariance of xy, which is how those two variables interact with each other, divided by the deviations of each of the answers to X on people's income and the answers to Y on how much people are paying. And the variance is that the standard deviation is that description, is that value for the dispersion of answers to those two questions. Pearson's R is not the only correlation coefficient test. You can also use Spearman's rank, and that's good for when you don't expect the relationship to be a straight line, you don't expect it to be linear, but maybe it will tail off either at the top or the bottom. Kendall's row is good when you have smaller samples, and particularly when your deviation, your sample standard deviations are higher. And the R-squared coefficient of determination is also another measure for the relationship between these two variables. Now, this was very much an introduction just to show you some of the mechanics behind calculating a correlation coefficient. But do not worry about understanding the algebra behind it and understanding all the X and the Y's and the standard deviations. Fortunately, you can do it in Excel. And all you need to know in a tool like Excel is what the formula is that you need to type in, or what the function is rather that you need to type in. So to find out what the correlation is between these two questions that we have here, so the cost of accessing the local healthcare facility and people's income, you use the function correl. You type in correl, and then it will give you the option to select the cells that you want to look at the correlation between. So look at those two answer categories, and then it will simply report the value here. So here we're looking at the correlation between the values in column C, so the cost of accessing the local healthcare facility, with the values in column D, which is income, and it's reported a correlation coefficient of -0.99. So that's almost perfect negative correlation. So as we can see, as income increases, the cost of accessing your local healthcare facility decreases. And as the cost of accessing the local healthcare facility increases, your income level decreases. So they're working in the opposite direction to each other, almost perfectly. Now, in terms of getting a perfect positive or negative correlation, that is actually extremely unlikely. And we've obviously created this example of Deviland and created this data for the purposes of this training package. You're often very unlikely to see such a clear-cut correlation or such a clear and evident pattern in your data. As a result, a correlation test might miss what the actual relationship is between two variables because your data is much more messy than that. And you need more sophisticated statistical tests to really understand if there is indeed a pattern or a relationship in your data that takes into account the fact that you've got all this other noise and all these other variables affecting how people respond to any given question. And of course, all the natural variance and distribution and noise in your data anyway. So more sophisticated correlation tests than simply the correlation coefficient usually are conducted in statistical packages such as Stata, R, or SPSS. So one of these more sophisticated correlation tests is what we call a regression analysis. And here's the algebra, here's the formula for that. So just breaking it down, we're talking about a dependent variable. So that second question, if you like. So what is changing up or down because something else has happened? So this is the dependent variable. And in this case, we're calling the dependent variable the cost of accessing the local healthcare facility. And we're looking at how it responds to somebody and their income level. So the independent variable is X here, your income. So your independent variable X, we're expecting to have some kind of relationship with cost. So we're looking at the relationship between these two different variables. The other signs in this formula are here, this alpha, which is a constant, and beta, which is the regression coefficient. So that tells you the amount to which the dependent variable is likely to change proportionally to your income variable, your independent variable. And here, this is your error term, taking into account that there is always going to be some degree of noise and variation in your data, so you're never going to get a perfect fit to this regression formula. When you conduct a regression analysis, you'll get lots of different values spat out at you that tell you something about the relationship between your dependent variable, your cost, and your independent variable, your income. You'll be given your intercept, which is your constant, that's your alpha. You'll be given your regression coefficient, your beta, so you'll be told what the value is of those different letters in your formula. You'll also be given the t-value, the p-value, and the r-squared value. And these are the measures that tell you the extent to which there is a true and real relationship that is statistically significant according to your regression analysis. The t-values and the p-values in particular are the ones that tell you whether or not there is a statistically significant relationship between, in this case, cost and income. And here the p-value is 0 and the t-value is 2.89. I won't go into the detail of what these particular values mean, but these are the ones that you interpret to identify the fact that in this case there is a statistically significant relationship between the two. If all of this is rather overwhelming, which I'm sure it is, if you're not doing a course in statistics at the moment, this may all feel like too much right now, but I just wanted to tell you a little bit about the workings behind the scene of the regression analysis and how we're looking for this relationship between the two variables, taking into account all the noise and all the variations in the intercept and the constant and so on. In practice, if you want to understand if there's a statistically significant relationship between two variables and you want to conduct a regression analysis to do that, again, there's a simple formula that you can use in Excel. It's this LINEST formula that's looking for a linear regression analysis, and it can report all of these values. So it will report the intercept, which is that alpha I showed you in the previous slide. It'll also show you the coefficient, that was the beta that was in front of the x value, and it will show you the r-squared value and the f statistic. And here the f statistic is another one of these statistics that tell you about whether or not the relationship is indeed statistically significant or whether it's just noise. And here the F statistic is very high, telling us we have lots of confidence that this is a statistically significant correlation. So just to summarize all that, here we've been looking at the relationship between the cost of accessing the local healthcare facility and someone's income. How do we have a look at that relationship and tell whether or not there's a meaningful correlation, a meaningful pattern? Well, we've plotted a scatter plot, and the scatter plot clearly shows, this chart clearly shows that as income decreases, the cost of accessing healthcare increases. This is a negative correlation as presented visually in this scatter plot. The r-squared value, which was reported in our just from Excel as we asked it to report on this chart, is extremely close to -1. So it's a near perfect negative correlation, -0.98, almost perfectly negative, with perfect negativity being -1. We can therefore say, based on this and the other regression statistics that we calculated using the other formulas that show that this relationship is statistically significant, we can say with confidence that our data in our sample shows that people on lower incomes do indeed face higher healthcare costs. That is a statistically significant correlation which we can talk about externally with a lot of confidence.
Right, now we're moving from correlational analysis and regression analysis to causal relationship. We want to establish whether there's a causal relationship that exists between two variables. And in causal relationship, you're asking, does the change in one variable causes the other to change as well? And by how much? What's the magnitude of that change? So for example, if it's saying we have identified groups that are left behind in this progress, in terms of progressing out of poverty. So why do they keep remaining poor? What drives those changes? So if you want to establish that relationship, that is what you're considering in causal relationship. Remember, in correlation, we're just merely concerned with whether two variables are related or not, And what is the nature of association? Is it negatively or positively related? And what is the magnitude of the relationship? Are they strongly related or weakly related, or there is no relationship at all? So correlation is not equivalent to causation. Causation, we are more concerned with what change in one variable driving a change in the other variable, while in correlation, we are merely concerned with whether two variables are related or not. So when we're talking about causation, there could be a number of ways in which two variables are causally related. It could be merely a coincidence that two variables seem to be causally related, and therefore we need to take into account, coincidence when talking about causality. It could also be that there is a confounding variable. So this is a variable that causes two, or that affects both variables you're considering. You will see in the example later about sale of ice cream and crime rate. And then you also need to take into account the case of reverse causality. So these are issues to consider when you want to conclude about causal relationship. We'll be discussing this in the next slides. Here's an example. A study finds out that in a particular period, there is high sale of ice cream, while at the same time there's high crime rate. So sale of ice cream is rising, at the same time you're seeing high crime rates, higher number of crimes being reported, and therefore you may conclude that the sale of ice cream drives crime. Well, that may not be the case. We need to interrogate further, because these two variables, there could be a variable that drives, that affects those, but both variables, and that variable is the confounding factor. So it affects the sale of ice cream, and at the same time, it affects the crime rate, such that we cannot conclude that it's the sale of ice cream that increases the rate of crime that has been reported in that period. And that confounding factor is high temperatures. So during high temperatures, more ice cream is sold, and at the same time, more rates of crime is reported during high temperatures. So the confounding factor that affects both variables is, the high temperatures in this case, and therefore, it is what is driving the changes in the two variables we're seeing, such that it affects high rates of crime being reported, at the same time it affects high sale of ice cream. And therefore, these two variables are not directly causally related. So that is the case. It affects both variables, as you can see in the arrows. This is another example of reverse causality, the case of reverse causality. So we are assuming that two variables correlate and might actually have a causal relationship, but in this case it's impossible to conclude which variable causes changes in the other. So we have, for instance, we have sunlight there, which is source of vitamin D, and we have being miserable. So we're saying lack of vitamin D causes someone to be miserable. Well, we're not sure, because even miserable people do not go out, and therefore they lack vitamin D. So in this case, it's almost impossible to know which variable causes the other. It could be that lack of vitamin D causes people to be miserable, but it could also be that miserable people do not go out often, and therefore they lack vitamin D. So in this case, it's reverse causality. We're not very sure which variable causes the other in this case. In most cases, we establish causality in controlled experiments. So in controlled experiments, we have two groups selected from almost the same sample. So we selected group A and then randomly selected group B. And then we induce some treatment in one of the groups while controlling for the other group. So assuming that we select a group A and then induce some treatment, and then you observe the outcome of that group A. In this case, let's say we're looking at poverty outcomes and whether social protection could help households reduce the poverty levels. So we select a section of households, let's say in group A, and then give them, cash transfers. And then you observe their poverty outcome for that group. So that is the outcome for group A. And then you have another household, another set of households belonging to group B, which do not receive the cash transfers, and then we observe their outcome over some period of time. So group A and group B are almost identical, except that one group receives cash transfers and the other group does not receive, group B does not receive. And therefore we want to look at the outcome of the controlled group and the treated group, where the cash transfers actually causes households to realize poverty reduction. So there is no other intervening variable except for that treatment. So that is the case of controlled experiment. In observational data, which we normally use for research, it's very difficult to establish causation, and that is because it's very hard to control real life, and because of that complexity and dynamism of life, we can't control what happens to a person at a particular point in time, and that is what makes it difficult to establish a direct causality. So causality requires that you have some form of control, so that when you induce a shock into a system, you can observe the real effect of that shock. However, a range of statistical techniques exist which we can utilize to establish a causal relationship. One of the ways is by use of lagged variables. So lagged variables are previous values of an outcome. So in this case, if you're looking at poverty level, you'll be asking, is poverty level currently affected by the previous poverty level of households? So we could have poverty level in 2022 expressed as a function of poverty level of the same household in 2021 and 2020 alongside other variables. So by inducing lagged variables, you're potentially controlling for the time effects, such that we get rid of anything that might have happened between the two periods between the two periods we are considering. Another is by use of instrumental variables, and in instrumental variables, this is a variable that we can use to control for some variable we can't observe. An example here would be if you're looking at learning outcomes of children, and you're saying we make a hypothesis that the outcomes of children, the learning outcomes is affected by their IQ, but then you can't measure IQ in observational data, and therefore you decide to control the IQ of the children by giving them competency tests. So it could be mathematical, it could be language or anything. So the results of that competency test tells you the IQ level potentially of the child, and that is the instrumental variable in this case. We instrument IQ by the competency test results of the children. So that also potentially control for something that we can't observe but affects our outcome variable. We can also infer causality from qualitative insights, where we engage in in-depth discussion with people about their experiences about poverty or whichever aspect we are studying, and this ensures that their voices are heard in explaining, while they're explaining the perspectives on what we're looking at. So qualitative insights can help us talk about some causality, and also use of the statistical approaches we've talked about, and also potentially inform us about causality. So here is another example of causation. So there is a qualitative study which finds or claims direct causation, but rather it's just the cost of there is a confounding variable. So in the qualitative study, the individual said that the local healthcare facility is in the most expensive area and area of the district, and we have little money, therefore we can only afford to live further away, and this makes the cost of getting to the facility much higher. So instead of claiming that there's a direct causation between your income level and the cost of accessing healthcare, there is a hidden variable which potentially affects this relationship between these two variables, the level of income and the cost of accessing healthcare. And that is the distance of housing from the healthcare facility. So this distance seems to drive up the cost of accessing healthcare. And so in this case, we do not have a case of direct causation between income and the cost of accessing healthcare, but rather there is a confounding or intervening variable which affects those two variables, which is the distance of housing from the healthcare facility. So that is the relationship that exists. So if you have low income level and you live further away from the hospital, then that distance means that you incur costs to reach the health facility. So it's much more expensive. Yeah, so you may also want to do comparative analysis to compare your results with the findings on the existing data sets. So you need to ask yourself, since you engaged in new data collection, what value did it add? Who did it pick, or what did it pick that the existing study missed? And how does that change the understanding of your audience? So for instance, in this case, you're looking at people with learning disabilities. Not too much data exists on that, and therefore that could be a gap that your study potentially bridges. So you need to bring that out. But then that can only be comparable if your data collection procedures and the set of questions is harmonized with other studies you want to compare your results with. So that is interoperability, which we talked about in the previous slides, so that you're able to draw your findings and compare with related databases what they find and whether the understanding is the same or it changes significantly. However, you can only compare your results with other studies if they're collected in a standard way. So sometimes your comparability of your results may be limited by the type of survey design you chose. So maybe someone did qualitative interviews while your study used survey questionnaires. At the time and mode of data collection, maybe you went collecting data face-to-face interviews, while the other person used telephone interviews or just mailed out the questionnaires to the respondents. That could potentially bring a difference in the findings from the tools, from the different tools of collection that was used. Also, it could be just the way you designed your questionnaire. Was it flowing in the same way? Are they following the same format? And how about time? What was the time period? Was it collected during the day, during the night? Which year, which month? So those are some of the factors that may limit the comparability of your results with the results from other studies, which you need to take into account. So this is an example of comparative analysis. We want to compare our survey, hypothetical, the Deviland survey, and the findings of DHS survey. So demographic household survey data that was collected at the household level. In terms of date, the DHS survey was collected in 2017, that is pre-COVID period. And our survey is collected in 2022, that means in the post-COVID period. In terms of the representativeness, the sample size of the sample of DHS is national representative, but our sample is mainly purposive because we're looking at persons with learning disabilities. So sample size 21,000 for DHS, and our sample size is 271. Overall, out of 82% of the population that DHS has information on, 83% are males and 81% are females. our survey, out of the 56% proportion of people, 60% are males and 45% are females. And so the question is, to what extent can our findings be comparable with the results of DHS based on these other factors: the time, the means of collection, the sample size, the proportion of males and females, or any other demographic characteristics of individuals. So those are factors to consider when you want to compare your results with the existing study. So we have collected data and we have analyzed, and now we have it. When it comes to presentation, we want to make an impact. That's why we were collecting that data. So how do we present it in a way that is impactful to our data users? So the question is, how is this evidence, how is it going to be received by the audience, and how do we intend it to be used? Who needs this data set? And you should ask yourself, what do you want your audience to know about the data, or to know about your findings? How do you want them to feel about it? Do you want them to own it? How do you have a buy-in? How do you get a buy-in from the audience about your data? And what do you want them to do with the findings after, with that data? What do you want them to do with that? So you need to present that in a way that highlights those three key areas of concern. All right, so then that calls for knowing your audience, because they are the people you're presenting to and you want them to take action. So know your audience. Are you presenting to an international audience, or are you presenting to a national audience? Are you presenting to government officials, the lawmakers, policymakers? Are you presenting to civil society organizations? Are you presenting to the general public? Or, even much more importantly, are you presenting to the people from whom the data is collected, the people who the data is about? So these are persons with learning disabilities. Knowing your audience helps you understand how to write your messaging, how to present, in which form of presentation do you choose, and how do you tailor your messages to suit the audience. So like I've said, based on the audience, you're going to choose whether you're going to present these findings via online platforms, which may be exclusionary for the larger majority, assuming the people in remote areas and do not have internet connection. That could be exclusionary. But that wouldn't matter if you're presenting to international audience, because that would be the most ideal platform. Are you going to give out physical handouts with a printout of the findings of your study to each and every person? So that also needs to be taken into consideration. Which language are you going to use? You should always use a language which is understandable by the majority, especially the people who the data is about. So are you going to present it in a vernacular, or are you going to have a translation? And are you going to simplify? You should simplify the data to people who do not understand the technical terms, and also give a detailed and contextual breakdown on the data that you collected. So knowing your audience helps you tailor your messages, and knowing which platform you are going to use to present, to bring forth this evidence in a way that is going to be impactful. Now, there is a range of options that you can use to present your findings in a way that's impactful. And again, this depends on the type of audience you have. So you may choose to use charts for data visualization, or interactive charts. Or you could just choose to give headline statistics, like say we found out that 50% of children have learning disabilities. Or you could present this information in a storytelling way and engage people, get opinion from the audience, allow them to contribute. Because by presenting your results and getting their point of view, you're making their voices heard and be counted into the final report. You're bringing this data to life, essentially. So that is the feel of the audience. Again, you could present by just infographics. So just some graphics with some information, depending on your audience again, because these can be easily understood by the technical people and people who have some knowledge about that. You could also decide to give long briefings and reports with implications on what you want your audience to do. So depending on your audience, you may choose to present your findings in these particular ways, in a way that brings life to them and brings life into the data and make them take actionable steps. So this is presentation for that's the way you can present your results for impact. Even as you present, do not remind your audience about how you collected the information, how was the data collected, build or develop trust and credibility in your data. Talk them through the methodology, including where plans change. Provide codebook and metadata, which is additional documentation explaining every detail about your data set. How was the sampling done? How were people chosen? How did you collect? What was the survey tool? Was it questionnaires or interviews? Who was sampled? Provide every detailed information about your data set. And report the sample sizes and any errors of uncertainty for your analysis. How many people were sampled? And what was the error what's the error of margin in your calculations? So in short, the audience should not be meeting only your results, but they should have worked with you, or you should have worked with them through the data collection, cleaning, analysis, and now finally presentation of the results. That's important because then it encourages the use and usability of your data, because people find credibility in it. Also ensure research ethics even as you present. So do not present results that are selective. And this is normally the case when people are looking for funding. You only want to present results that is appealing to your donors. So present the findings regardless of how they look, because it's not only your organization that will be interacting with these funders. So no data mining. And then do not give misleading information. So don't overemphasize small changes. Do not overclaim. Just present it and don't come out as though you are campaigning or you are persuading people to join your team. Check also against the plagiarism. So only present content which is yours. And if you have someone else's piece of work, make sure you cite that. But it's important to just only present your work. So again, who are you presenting to, and how are you presenting it? And we mentioned in the previous slide that it's not the first time that your audience needs to be seeing your data. So do not just pop up with the results like a submarine, but walk them through. We expect that you shall have built a long-term relationship between you and your audience, or the people data is about, or you're presenting to, so that they're involved in the process of data collection, survey design, understanding the data context and standards that are followed, the ethical considerations. They've also been involved in the legal framework. So build a long-term relationship. Again, design the presentation formats in a way that is easily understandable to your audience. So consider the language you're using, which format are you presenting to, and are you doing just the interactive charts for data visualization or infographics? So how are you presenting it to your audience in a way that is easily understandable and easy to follow? And then complement the data outputs with engagement activities such as workshops and meetings and social media. People like to be engaged. They don't want to be fed with information, but also involve them in the presentation. That way they are active, they give their views, and they feel that they own the data and they own those findings. So it's like getting their buy-in in the validation of their findings. This is an example of our Deviland, our hypothetical example. So we have collected data, we have analyzed, we are now presenting. To who are we presenting? We are presenting to international donors. We'll be presenting to the Ministry of Health in Deviland, and we are also presenting to CSOs for persons with learning disabilities. So how are we presenting this? We are going to state the purpose, and the purpose for the international donors of healthcare was to mobilize funding for persons with learning disabilities in health. And the purpose for the Ministry of Health in Deviland is that the health needs of people with learning disabilities should be prioritized. To the CSOs, we want to provide credible evidence to support their advocacy efforts. And what are we presenting? So we are presenting online charts, online interactive charts on the International Comparative Tracking Progress Platform with methodology and metadata and codebook supplied to the international donors. To the Ministry of Health, we are giving them briefing in local language with statistical standards, with statistics supported by human stories, comparisons with national admin data in the local language. So that is what you're doing there. And to the CSOs, we are doing simple, shareable graphics, charts, and human stories in a local language. So this is easily understandable by them. How are we ensuring engagement? With the international donors of healthcare, we are conducting an online and international, we are presenting in an online and international platforms, and that allows them to engage if they have any questions, if they have comments. And for the Ministry of Health in Deviland, and the CSOs as well, we have a workshop bringing them together so that they can discuss the implications of these findings on what to do. Yeah. So in summary, on data analysis, communication, and use, in this module we have looked at how we can, construct descriptive statistics, how we can do disaggregated analysis, correlation, causation, comparative analysis, and how we can present our findings for impact. So on the descriptives, we have the main parameters of data collected, understood, and we have some statistics on that clearly presented. We have also done disaggregated analysis, how you can do between individuals and groups of people. So let's say you can have results for men and women separately, or for different age cohorts, or for different regions within Deviland. And on correlation, we have shown that this is just some form of relationship between two variables, not necessarily how strong they are, or which variable causes the other to change. We've also highlighted on causality and said causal relationship is more stringent, and it looks at to what extent does changing one variable affect the change in the other variable, besides just some form of relationship existing. And we showed how we can achieve that by controlled experiments, by using instrumental variables and lagged variables, and also how qualitative study gives more insight to the trends and patterns in the data we see and any form of relationship. So it helps to explain more. On comparative analysis, you compare your data sets with compare the findings of your data sets with the findings from the existing data. What value addition have you made, and was this data comparable with other data sets? So as long as they're interoperable, you can compare your statistics, and it has to be compatible. It has to be compatible across so many dimensions: time, the sample, the sampling procedure, the type of data which is collected. So many other things need to be taken into consideration. And finally, this evidence is not for you, it's for people to use to influence policy. So how do you make your presentation in a way that is impactful, knowing your audience and knowing which type of platform to use to present these findings, and How are you presenting the finding? What do you want your audience to get from this? What do you want them to do? And do you want them, how do you get a buy-in the results from your audience? How do they feel the results? Right. Okay.
So that brings us to the end of this training course, that is the data support package to the Leave No One Behind partnership delivered by Development Initiatives. We hope you found the content and the tools and resources that we've shared with you useful in your own country context. Now, to apply this in the work that you're doing, this training course is also complemented by a checklist. And this checklist follows the same structure with 3 modules with different sub-themes and asks specific questions that you should apply in your own country context as you work through the data life cycle. So we hope you find this checklist useful, and working through it, there's also some additional references where you can find out more detail and more information about each of the topics covered. So you can go into each of these topics in much more detail. There's been a whole breadth of topics covered, none of which we can do full justice to in a concise course like this. So we do encourage you to look into some of those reference materials and read up and spend more time exploring some of the specific issues that we've covered here. Now, the objective of this training course was that you, the participants, have improved knowledge and capacity to apply this understanding of data-related issues to your own country context. The only way we'll know if we have achieved this objective is if you tell us. So please also complete the post-course survey, telling us what you thought about the course, what you've learned from it, where there are gaps and where we can improve it in the future, and what additional tools and resources you might find useful in support of building the quality of your community-generated data. But for now, that's it from Joshua and I, and we wish you all the best in your endeavours to collect, manage and use community-generated data in your efforts to leave no one behind. Thank you for your time, and do get in touch with the feedback on this course and with any other questions or comments. Thank you.